Our first speaker is no stranger to Regis College. He's been here before to tell us about healthcare reform. It's Brian Rosman. He's the research director of Healthcare for All in Boston. He spent some time with the Massachusetts Senate Ways and Means, and that's probably a good place to start if you're going to understand about political maneuvering. He was also worked on the Committee for Healthcare in the Massachusetts Legislature, has done some work for HCFA, and now is the Research Director for Healthcare for All, Brian Rosman. Brian?
Here we go. Well, thanks so much, and this is just such a momentous time to be here and talking about health reform. Thank you. We got to start, I was watching the signing ceremony yesterday, and we got to start with the immortal words of our Vice President, who I think put it so well. I don't know if you guys heard, but what the Vice President said was, today America becomes a whole lot wealthier because tens of millions of Americans will be a whole lot healthier. That's what the Vice President said that we want to remember. No. What I want to do is actually not talk about a little bit about national health reform, but a lot about Massachusetts health reform, because we really led the way. And what was passed, what was signed into law yesterday, in many ways mirrors, or it sort of follows the blueprint of what we did in Massachusetts in some ways. So I'm going to talk about the coverage issues. We're going to hear later about some of the quality and cost issues. And what I want to do is sort of compare and contrast what the laws say, and then tell you a little bit about the results in Massachusetts. I work for an organization called Healthcare for All, and we're an advocacy group. We work on issues of children's health and health disparities and oral health and so on. But what I'm going to try to do today is not give you an advocacy side of the world, but try to step back and give you kind of an analytic side of the world. But then when we get to the questions and answers, you want to know how I really think or what I think is good or bad, I'll be happy to do that. Healthcare for All, as you can see, oh, we don't have the slides up. How do we get the pictures up?
Here, right there. That's on the computer. Oh.
It's on the computer here, but not, here we go. So you missed my pretty picture at the beginning. Okay, isn't that cool? State House, Washington.
Great.
So we at Healthcare for All, we work on these coalitions on healthcare policy. We also try to help consumers. We have a helpline, which has been deluged with calls in the last 2 days. What does health reform mean to me? People are already calling. We're getting calls from all over the country, in fact. But we are a really good resource for people in Massachusetts in particular who need to enroll in healthcare programs. And then we do email updates, so we have a website, and our blog is really one of the central sources of information on state health policy. So if you want to know about what's happening in Massachusetts, you can follow us on our blog. So let's get into it. The health reform that passed in 2006 was not the first time we've done major health reform. In fact, every 10 years or so, the state of Massachusetts seems to does a really big health reform. And every time we do something big here, it influences what happens in Washington. And the national models take and learn a lot from our pioneering effort. In 1988, under Governor Dukakis, we pioneered a really broad universal coverage plan. I think a lot of people remember that plan for it, not what didn't happen. What didn't happen was the employer mandate, the requirement that all employers have to provide coverage. That part was never implemented. If you remember, after 1988, the state entered a really steep recession. At the time, it was the worst recession we had had until the current one that we're in. And then we elected Governor Weld, and there was just not a lot of interest in the Dukakis employer mandate part of the bill. But there were other parts of that bill that were stayed in law, were never repealed, that are a really important part of our health insurance system in Massachusetts now. There's a program called Common Health, which provides health care for people that are disabled. The requirement that all students have health insurance. A lot of students here, right? You have to have health insurance. Ain't so good, right? But that started from the 1988 law. The medical security program that provides benefits for people when they go on unemployment benefits, and the Healthy Start program, which was for kids. All of those programs have analogs in the national scene, that started here in Massachusetts. So that was 88. Then in 96, our governor was Weld. His Human Services Secretary then was Charlie Baker, another name in the news. And they conceived of a really dramatic change in the way Medicaid benefits are paid for and who's eligible. They dramatically changed, simplified the system, expanded eligibility dramatically, created a managed care system for Mass Health, which was the new name for Medicaid under this 96 reform. And Medicaid expanded dramatically, as you can see, from 670,000 to a little over 1 million, and that created a dramatic drop in the uninsured. And all of these influenced the national thing. The 1996 reform in particular, we talked with Senator Kennedy, me and my boss right after that, explained how we raised the tobacco tax to expand coverage for kids. And you could just see Senator Kennedy's, the wheels turning, oh, I could do this, you know? This would work in Washington. That became what's now called CHIP, which is covering tens of millions of kids. So in 2006, 2004, let's say, we had expanded Medicaid. We were doing really well on covering very low-income people. But the number of uninsured were growing dramatically, mainly because of moderately to low-income people who were employed, but either their employer was not offering coverage and they couldn't afford coverage on their own, or their employer was offering coverage that was unaffordable. And if you wanted to buy insurance on your own, there was no easy way to do it, and it was very expensive. So the uninsured were mostly male, they were mostly young, minorities were overrepresented, but they were working and they had jobs, they had some income, and they didn't qualify for Mass Health or Medicaid program. So the proposal worked its way through the legislature, and in a very bipartisan basis. So you see here, you know, Governor Romney, conservative Republican about to run for president, and Senator Kennedy, a liberal Democrat, sort of the standard bearer for the liberal Democratic side. Both were smiling, both were happy with this bill. And I think one of the questions we have to ask ourselves as I go through this story is, why is it that in Massachusetts we were able to do this kind of centrist policy that brought both Republicans and Democrats, liberals and conservatives together, but in Washington they couldn't be further apart, even though they're doing approximately the same policy, at least I would say, and that's for you to decide. So in 2006 we signed a law, now it's 4 years later. What have we accomplished? Well, I think it's really quite remarkable that the growth in coverage is over 400,000 people. So we've reduced the uninsured rate dramatically, and people are getting coverage in lots of different ways. Some people are getting subsidized coverage either through Medicaid, the Mass Health program. Other people are getting subsidized coverage through the new sliding scale premium assistance called Commonwealth Care. And then others are getting unsubsidized coverage. There's been a big growth of individuals just buying insurance on their own, and there's been a growth in employer coverage. So it's not one thing that worked, it's a whole bunch of things that was part of the Massachusetts plan. As a result, our uninsurance rate is roughly 2.6%. We've covered just about everybody in the state. For kids, it's even better than 2.6%. For working age adults, it's about 4.5%, 5% or so. So we've really dramatically reduced the number of uninsured in Massachusetts. And the people we've covered have been both high income and low income. So this chart shows the uninsurance rate on the left side for low income people. As you can see, when we started out, this is like 2006, 2007, 2008. The 2009 numbers are about to come out. Well, we started off with 2006, it's about 25% of the low-income adults were uninsured. We reduced that to 7.5%. But also high-income adults, there are a lot of higher-income adults that also were uninsured, and that number has also been reduced. So again, the evidence shows it's been a pretty balanced approach to covering the uninsured. And the other thing I just want to point out is I've been showing you these statistics. This is a woman that the connector identified who got coverage. And you know, for us, we get calls at our helpline every day. All these statistics represent individual human beings, and we can't forget the human face behind the uninsurance statistics. And as we, you know, President Obama and the congressional leaders talk about the national bill, I think it was very important that at the bill signing yesterday, The president had a young boy whose, I think, mother had died for lack of insurance, a small business owner who couldn't afford insurance, another person who was uninsured who would get help. I think we need to always recognize the human face here. So there are 5 components to the state's coverage expansion, and I want to go through them one by one. And the question is, what did we do in Massachusetts, and what is Washington, what is about to happen coming from the national? So number 1 was the Medicaid expansion, which I'll explain. Number 2 is subsidized private coverage on a sliding scale. 3 was changing the insurance market to make it easier for people to buy insurance. 4th is the individual mandate, the requirement that all individuals, if it's affordable, you have to buy insurance. And 5 is what we call employer responsibility, the requirements placed on employers. And all of these are in national reform. So the national reform includes a Medicaid expansion. It also includes subsidized private coverage for low-income adults and families in the national bill. It also includes changes to the insurance market, which will help both individuals and small businesses, the individual mandate, and the employer responsibility. So everything that we did here is done in Washington, but they did a lot more. They did work on changing the Medicare, there's delivery reforms, there's tax reforms. There's a whole lot more that at the federal level they were able to do that were not part of what we did in Massachusetts. So let's go through them one by one pretty quickly, because we're going to want a lot of time for questions. First was the Medicaid expansion. The main expansion for Medicaid for the Mass Health program was for children. So children were covered up to 2 times the poverty level, 200%, and that went up to 300% of the poverty level. And that allowed a good number of children to get into the program. The law also added smoking cessation and some other wellness benefits, and it also included a program to get people enrolled. And there was a whole community outreach program that had community groups and hospitals and community health centers all being trained and given resources to get people enrolled. So that was number 1, was the Medicaid expansion. In the bill that passed in Washington, there's also Medicaid expansion, but not to 300% of poverty, but to 133% of poverty. So that's because in Massachusetts, we were already covering a lot of adults up to 133% of poverty. And so this Medicaid expansion for the rest of the country will bring people, for adults, up to our standard. It also, in the federal bill, was an increase in primary care reimbursement under the Medicaid program. So primary care doctors in Medicaid will be getting a higher reimbursement level. And equivalent to what we had in Massachusetts, the kind of community outreach program, there's also funding for what they call navigators, who would coordinate community outreach. So all of that is pretty much mirrored in the federal bill. The next thing we did is the Commonwealth Care Program, and Melissa, who's here, ran the Commonwealth Care Program until a few months ago, so if we have questions, she can answer them as well as I. But basically, it's subsidized sliding scale subsidies for private coverage for low-income adults up to 300% of the poverty, which, by the way, that's about $31,000 annual income for an individual. They choose between, if you're in the program, you have 5 managed care carriers that you can choose between, and the different insurance plans. And one important thing is that we have, that's going to be very difficult to do at the federal level, is the single application for all programs. So when you apply, you don't apply for Commonwealth Care or for Mass Health. You just fill out the application. And the big computer in the sky looks at your application, figures out the best program that you can get into based on your income, the age of your kids, your family situation, and tells you you're eligible for this program. And that makes it a lot easier for people, because they don't have to worry about exactly what are the rules for which program, because the rules can be very confusing and difficult for a lot of people. So the Commonwealth Care Program, for low-income people, if you're below 150% of poverty,